Whereas I thought that would be a big problem coming to China, obviously the language barrier, but when you come and there's 3 or 4 interpreters within the ward, the doctors come round, some of them speak good enough English to communicate with, but they will talk to the interpreter and the interpreter will tell you exactly what the doctor said, although you can communicate slightly but not 100%. Yeah, it's not that's not anything to worry about with the staff, and I've never met such a friendly bunch of people actually. You know, if you're in a hospital in the UK, you're just a number. Yes, you get some friendliness, but here the friendliness over the anything to help you. Friendliness and overwhelming, and very helpful, very concerned. Yeah, I mean, it's very good. Well, first of all, when you arrive, generally they'll give you tests, blood tests, usual urine tests, whatever. Fairly basic procedures. A couple of days therapy. Therapy consisted of electric wave therapy, which was like a TENS machine with electric pads put on legs, arms, 30 minutes every day. Acupuncture, legs, arms, 30 minutes every day. 1 hour physical training every day, which is difficult when you're feeling very lethargic and tired all the time. It's hard work. Yeah, but when you come here for your treatment, you're in the mode to do anything to help yourself. Stem cell treatment was probably one of the things I feared most. You hear this, oh, you need to go to the transplantation room. So the first thing I thought was, oh, they're going to cut me open and throw some stuff into it. But yeah, it's only, I was very curious to ask, what is stem cells? What do they look like? What are they doing? So all the doctors, very cooperative, were quite happy to show you what was doing. All it involved was before the treatment, maybe I think 2 hours before the operation, gave you an IV injection just to purely clean out your system and put fluids into your body, and then to go back to the transplantation room, which they took you along the bed and wheeled your bed into the room. You just lie on your side. They put a painkiller into the IV drip, which was attached to your hand. The painkiller was maybe the most pain I felt, was for about 3 to 5 seconds of the fluid going up my arm. But literally 5-10 minutes later, they were injecting stem cells into my spinal column, which I never felt one bit, and I think that maybe took, because they inject it slowly into your spine, it maybe took 5 minutes, 10 minutes. It seemed like that anyway, lying down. Then when the doctor said, you're finished, I thought, oh, that's it, that's quick, you know. And then the next part, you're out back to your room, and to lie for 6 hours on your back, it's probably the hardest procedure of it all. I came here very, very open-minded, tried to be as normal in my thoughts as possible. Obviously, I think going any country in the world, people automatically feel better. The holiday effect, being abroad, I think that's normal. But as I said, I came with an open mind. I came, done my therapies. I didn't feel too much improvement after therapy. I maybe felt just a little better after doing exercise, but nothing to write home about. And then to have an injection, and the very next day for my speech to improve was was phenomenal, to say the least. It was, you know, and definitely the exercise I was doing for my legs, that certainly didn't improve my speech. At least I don't think the legs are connected to your mouth. You know, and my friend who was with me, the first thing he said that the following morning, as soon as I woke up and spoke to him, he said, "Oh, Brian, I think your speech has got so much clearer already." So, do you think so? So then I started to try do more balancing exercises and the simple things again, like touch my nose, like whereas before I was maybe, you know, I could touch maybe 70% of the time. Lots of times I would miss, but you know, and I was going, oh, something's happened, you know.
Overnight?
For me, yes, overnight. It was really that incredible, yeah. And the more, so that was maybe after 4 days having been here, and the longer I was here after second, third, fourth injection, I was feeling so good. I was just wished I was getting more injections at the time because my improvements were so good. So that's why this time I opted for the 6 injections, which I hope will have a longer effect of well-being on me. And obviously the way Bika is going with stem cells, it's another year down the line, so there might be a lot more improvements from their side. Yeah, I loved cycling. That was one of the most cool things to happen, you know. Before I came here the first time, I stopped cycling because just had no balance. I never had the energy to go cycling, and fear of falling off. Then to go back after stem cells and get on the bike, granted first couple of times weren't great, I could do it, weren't great balance wise, but now I try to do a good few kilometers every day and keep my strength up, and it seems good. But you know, simple thing like, I mean, cycling a bike, but to have that freedom to be able to just cycle down Main Street in my home and go where I want to go. Yes, sometimes I feel tired. Okay, stop, go again. But no, it was amazing. Even to go outside and kick a ball with my son was becoming more and more difficult. Just standing, sore legs, go to kick the ball and feel myself going to want to fall over all the time. Then come back after again, and you know, I could do this. Not easily, but I could do it. I certainly haven't David Beckham, it's pirouette or anything like that. To be able to stand and kick the ball and try to attempt to run again, you know, before I can do this. Wouldn't even think about it. So no, it's been completely life-changing for me, you know. Back then when you go to the doctor and they say you've no help, my first thought was probably neurodepression, thinking what's going to happen, maybe be an alcoholic, but I've no future. And now to come and be given a future again, my whole life's just turned around. It's been incredible. I now come back for a second lot of treatment. For the first had lasted 4 injections, seemed to have lasted me 10 months. I started to feel my speech starting to slur again. Maybe a little shakiness come back. So having raised a substantial amount of funds to come the first time, there was enough for a second treatment, but without therapy this time, which I was curious to see what the stem cells had actually done between therapy and stem cells. They obviously work, having had the experience, they work so good together, hand in hand. From the first I had so much improvement, speech improved, shakiness disappeared, balance improved, energy levels were sky high again, probably more sky high than any normal person. So to feel it coming back, I was a little disappointed after 10 months, you know, thought, oh, I wished it'd last longer, but the funds were there to come again. So I came again, I got 6 injections this time, and although no therapy, I still feel the benefits for speech, for energy again, has went up. Balance, I think, it has improved, but not greatly. But with doing, because I never done therapy here, I had started doing it again at home, and hence it improved again since I went home. So to me, the therapy and stem cells work good together. I've never felt so good in years, you know. I don't know, just before treatment, I just felt I was becoming so lazy, and like that. Now I feel as if I'm just stronger again, yeah. And I did see a couple of patients whose their improvements were, with ataxia patients, their improvements were immense. In the month I was here, I thought it was actually looked to be supernatural, a difference in these people, what was happening to them. But having spoke to them, they went home and they were the same, went back to square one again. So maybe, yes, maybe it is placebo effect in that form. But you know, for myself, having come 6-10 months and still feeling good, it's definitely not placebo effect. It doesn't last that long. And to have seen little kids, 2, 3, 4-year-olds, cerebral palsy and things, and not being able to crawl, then to be able to crawl again after injection. Now, I don't think a little kid can get placebo effect. I don't know. I don't think so though. You know, there's a little 2-year-old as well in Hanju, cerebral palsy, who could only walk with the baby walker 2-3 steps. Then eventually her mum and dad had the ball with her, and she was walking laps. I don't know why I mean, definitely stem cells do something for me, having seen it. Yeah, and even in older patients, there was a guy from New Zealand, I can't remember his illness, but he couldn't lift his hand. And after stem cells, he could start moving his hand back up again. So, you know, simple things like this, like a normal healthy being doesn't even think about, when you can't do something and to be able to do that again, it's quite incredible. Yeah, you know, because I've had it over a year ago, then had it again, I think I'm just getting a bit used to it now. Yeah, you know. I think that, like you do with anything, if you start to feel better, you start to expect, well, I want, you know, if I go another 1.5 years down the line, and I feel worse again, I know what to do. Yeah.